is Lindsay and I'm a respiratory therapist. Currently, I am working in critical care in the neurosciences intensive care unit at the University of Alberta Hospital. I have grown up in Edmonton. I was born and raised here, both my parents, and my dad was also a graduate from NAIT. He's an electrician, and my mom is a stay-at-home mom, and they just were really proactive with getting us to stay in school and really follow our dreams and pick our interests and just continue with them. And I went to Misquitchie Academy in my grade 10 year. The first 6 months, I never went. I probably missed a majority of my first 6 months in my grade 10 year. I was just the name on an attendance list. They didn't even know what I looked like. They didn't know who I was. They would call it every day, and I was just not there. It's a big step in the right direction when I got to speak to my career counselor, and that's what Wanda's role was. And we went to open houses and just kind of opened my eyes to the world and how I could contribute to society and just play a big role and get everything that I wanted, and realizing that education is that building block you need to get to where you want and the things that you want and the life that you want to live. Respiratory therapy was quite interesting to me when I did a open house at NAIT. They were ventilating pig lungs, and it looked very interesting to me. It was very invasive. I wasn't aware of the other roles that they also do in the community, but it just seemed very interesting as to how they were able to maintain just one organ and make it work properly as if it was in a person. So that's what caught my eye. For schooling, it was a 3-year program. I had to have my biology and my chemistry 30. Physics is also requested. It's not mandatory, but there is a physics aspect of it. Also, basically all your 30s to get into the program, and you do part of it in the clinical setting. Half of it, I would say, is majority, inside the hospitals, one-on-one with patients. You have a preceptor who's going to guide you through your teachings and stuff like that. So it's part in class and then a lot of hands-on. It's easy to get discouraged. It's easy to fall off your goal path, but based on some criticism, but you just have to take it as it is and grow and build on it. There's many areas that a respiratory therapist can work in. There's in the community, there's home care. A lot of people think that respiratory therapists just focus on asthma and COPD, but there is that aspect of it also. And then in Emerge, there's a lot of RTs in emergency departments and in intensive care units and on the wards. So we're basically everywhere. I work shift work. In the hospital setting, a lot of it is shift work. It's 7 to 7 usually. In the clinical setting, it's usually Monday to Friday, 8-hour days. And then in home care, you kind of manage your own schedule. You have a patient workload that you go out to these houses and see your clients and make sure that their respiratory status is maintained. You have to be a people person. You got to be able to talk to people. You got to be approachable. You basically have to have critical thinking skills. You got to be able to think on the spot. Troubleshooting is really important. Being alert and attentive to certain things. Also, perseverance. You have to have a very high degree of integrity, and be able to communicate with your peers is a really big aspect of it. You are a crucial part of a critical care team. There's just so much you can do. You can be in the city if you're born and raised in the city, you can definitely stay, work in a hospital. There's rural hospitals that hire respiratory therapists, and then there's also therapists that go out to the reserves themselves that customize their care towards people that are on oxygen, that have terminal illness on the reserves. So you don't actually have to leave the reserve if you want to stay there, and you would be working out of a hospital that would go to these places. 5 years from now, I hope to be specializing still in neurosciences with respiratory therapy. I would like to be in a supervisor position, and I'd like to go out to high schools and talk about my life experience, what I've done and what I've accomplished, and hope to inspire other people to follow their dreams and never be discouraged, and always just, if you got your mind set on it, you got that perseverance, that determination, anything's possible.